Well, again, I hope everyone had a good Mother's Day yesterday, and to all the mothers and to the people that actually aren't mothers but are inspiration to kids and help raise them. Thank you, and hopefully Dr. Whelan got spoiled, and even you, Deb, got spoiled yesterday. So, to everyone out there, I hope it was a good day. Today makes 424 days since our first case of COVID-19. We're in week 61. And there are no new COVID-related deaths to report today, which is good. And however, we did announce one COVID death on Saturday. Once again, my thoughts and prayers are with the family, and it brings us to 377. So as of yesterday, we have 56.1% of Albany County's population has received at least a first dose. 46.8% has been fully vaccinated. And then if you look at the state's website, I know it gets a little tricky because these are questions that we have of emails and people calling, want to know. The state has us at 67.5% for people over 18, and you got to kind of break it down a little bit because you still have the population between 16 and 18, but it's a good number. But it doesn't mean we are there. It doesn't mean that you can, people don't need to get the vaccine who are on the fence. We need you to do your job, roll up your sleeves, and be part of the solution, not part of the problems, so we can get back to some type of normalcy. The statewide first dose vaccine rate is now at 48.2%, fully vaccinated is 38%. Thanks to Dr. Whelan and her team at 175 Green Street. You don't need an appointment. You can still walk up Monday through Friday, 9 a.m. to 3. Please show up. If you got questions, someone will talk to you. They'll walk you through it. And also, and it's good to have Deb Bertana here from our seniors, anyone over the age of 60. If you're homebound, you have an aid, you need a ride, we'll provide it for you. 518-447-7198. 518-447-7198. If you need assistance, we'll make sure you get there. Again, we're trying to do everything possible to get people to get the shot. I've been talking to a few people in Feed Albany and Pecan through United Way and internally in our staff with my deputy Dan Lynch and everyone about what we can do to get that push. Be to get a shot, get a free drink at a local restaurant or an appetizer. We will be announcing that, but I know people are doing different things, and I want to say thank you for everyone trying to come up with different ideas to get people, to encourage them to get the vaccine. I know the governor did the Yankees and Mets. You can go there and get a shot and get a free ticket. So again, please, we need everyone to do their part. We're having another first dose vaccine clinic at Albany Capitol Center this Thursday, May 13th from 4 to 7. Please, it's easier for our staff logistically if you sign up. But if you want to walk in, you're more than welcome. If you're just in the neighborhood and you go by and decide to get the shot, or again, if you want to talk to anyone, stop in. The whole staff of the health department is very helpful. And you can even see Dr. Whelan. She'll talk to you, right?
Yep.
To get through it. So please, anyone who's at least 16 years of age and above, if you're not there with your parent, we need a signed letter from them giving authorization so you can get the vaccine, but you don't need an appointment. Like I said, walk-ins are welcome. Second doses that have already who've gotten the first will also be Thursday by appointment only. So again, they reach out to you. So with the second shot, the appointments will be there. So we continue hopeful that Pfizer will continue to put out the guidance from 12 to 15-year-olds. So we're waiting for that, and that's going to be another huge, big step in the right direction to get us going there. And if eligible, we will do a pod for that. We will work it out. And I know Dr. Whelan's team has been on this, and our team about working with the school districts and so forth. But, that's just another step in the right direction so we can get back to some type of normalcy. But unfortunately, when we're looking at the numbers over the weekend, one survey found that only 30% of U.S. parents plan to allow their children between ages 12 and 15 to get the shot. Then there's when the age eligibility is expanded, 26% of those who responded to the survey fell into the category wait and see. They want to wait and see what happens. Among adults who haven't gotten the shot, the same survey found that only 9% said they plan to get the vaccine. So I know there's certain people that are waiting or don't believe in the science. Please, and Dr. Whelan can talk about this better than I can. CDC they go through a lot of steps to get a vaccine out into place and clinical studies, and I know people feel like it was rushed, but the science is there, the amount of shots have been out there, so please, again, educate yourself, talk to your doctor, talk to your pediatrician. I know every doctor's talking about this, people that are pregnant, should they get the shot and so forth and so on, or plan on getting pregnant. So again, talk to your pediatrician, talk to your doctor, and we'll get through this. As of today, there's 24,035 cases. That's an increase, which is a good number, 13 positive cases since yesterday. Over the last 5 days, our average has been 22.2 new positive cases, and before that was 22.8. Of the new positive cases, we also know 9 had close contact with a positive case, 4 didn't have a clear source, and no more healthcare workers, which is good. Albany counties, and this is a really huge step in the right direction. Albany County 7-day average for percent positive rate is down to 1%, which is now actually the second lowest in the region. This is the lowest we've been since the 16th of October, showing that the vaccine is working. It is working, people. It doesn't mean we can step back, doesn't mean we can loosen. It just means we're going in the right direction, and the vaccine is working. The capital region's at 1.4% for the 7-day average, so we're even lowest in the capital district. There are now 179 active cases in Albany County, 414 people under mandatory quarantine. Yesterday it was 464. There was 1 new hospitalization overnight. There are now 21 people currently hospitalized from the virus. Yesterday we're at 21. There are 8 patients currently in the ICU. Yesterday it was 10. Please, we continue to say, I know, listen, I do read the comments. I have for the last 61 weeks. And I know people don't believe in masks. I get it. Look at the flu season, look at the allergy season, respiratory issues. A lot of it's worked for a lot of people, for a lot of different, wearing a mask has had other benefits other than COVID-19. So please, I know we're almost there. We're almost through this. We're getting through this. If you look at what happened over the UK, the studies are doing over there, they're basically saying the amount of people getting vaccine, it could almost wipe this whole COVID-19 out by the end of the year. But we continue to need just to stay strong, vigil, wear a mask, cough into your arm, clean your hands, stay 6 feet apart. There's different guidelines out there. So if you're both fully vaccinated, and Dr. Whalen can talk about this more than I can, you don't have to wear a mask. If you're out in public, you don't have to wear it. If people are fully vaccinated, people still choose to be safe and be cautious. That's good. And the other issues, we do have people that get fully vaccinated now think they're Superman or Superwoman, and they don't need to wear a mask anymore, and they can just go out and do whatever they want to do. You can still get it. It just doesn't affect you, but you can still spread it. So please continue to do your part. And we're almost done. I can't believe it, that we're almost at the end of that tunnel, and we're just about ready to jump out to get into what things are going to look like going forward. But Dr. Whalen.
Good morning. So yes, we do plan to hold first dose pod this Thursday at the Capitol Center, and we are eagerly awaiting news which will come from the FDA and CDC on the 12 to 15 population. We've had a lot of success in vaccinating the 16 to 18-year-olds with Pfizer, and again, it's very important that parents consider vaccinating their child when this becomes available to them. It is a great step to get us back to normal. I know a lot of parents who have been asking me for months when this authorization will come, and it's going to be a big relief to a lot of people. We continue to work closely with our partners at the hub, with other local county health departments, and with many community-based organizations on trying to get the vaccine out to places that people may have challenges getting to either our pod or to other places where they can get vaccine. If you know a population, if you are concerned that you think that an area you live in, Albany County, may be missing, we want to hear from you. We're very eager to work with everyone in the community to ensure that everyone that wants a vaccine can get a vaccine, and for those that are on the fence, to make sure that you're provided with the education which you need to make the best decision for you and your family. We continue to encourage people to have conversations with their primary care doctors. We encourage parents to have discussions with their pediatricians. All of this to allay your concerns so that you feel comfortable in the decision that you're making for your child and for your other family members. Vaccination is the way we are going to get through this. Our numbers are very good in Albany County, but they are not as good as they need to be. We need to continue our efforts to vaccinate. And working with our partners is the best way to do this. We continue to explore out-of-the-box strategies and have continued as well to have walk-ins at the health department. Again, we're located at 175 Green Street. That is the parking lot of the old DMV off of South Pearl. So please come down if you are looking for a vaccine or if you just would like to speak to a health educator to learn more about how to protect yourself and your family. In the interim, we continue to reinforce the messages of wearing your mask when you are out. If you are fully vaccinated and outside and not in a crowd, you can currently go without a mask, which is helpful for a lot of people who are enjoying the nicer weather. Wash your hands and stay at home while you're sick. If you are experiencing any symptoms, it is still important to be tested for COVID. We are still seeing cases. We are still seeing hospitalizations. And unfortunately, even as recently as the last week, we are seeing deaths from COVID-19. We need the assistance of every single county resident to get through this. If it's information you need, please don't hesitate to reach out, and we hope to see you at our clinics.
Thank you, Dr. Whalen, as always. And, as more and more people choose to get the vaccine and we can get the spread of COVID-19 under control and get back to some type of normalcy, the world is different. It's never going to go back to pre-COVID world. It's a lot of things change, the way we do business. And the people that have been more resilient in bouncing back are younger kids in our county that, had COVID-19, got affected, were infected, and it didn't hospitalize them. And thank goodness it didn't have a devastating effect where they fell to COVID-19. But some of the populations that have suffered through this is our seniors. Our senior population has been isolated. There's still seniors that have not come out of their house, won't come out of their house, even though they get the vaccine, because they're afraid. And they've been isolated. And we had we have senior centers all over Albany County, all over the Capital Region. We have outreach for seniors, daycares for seniors, and then we do conjugate mail sites for seniors to come together. And sometimes that's the only time all week they really get to interact with the outside world. They get out to see other seniors, they get to talk to people, and they get to socialize. And socialization for a lot of people is what they need, and people enjoy that and stimulate them. And, one of the things I can say, it is kind of weird because I was talking to a couple of my military people at drill last weekend, and to me it reminds me of mobilization when you're gone for like 18 months and you come home. Everything's different, the way you look at things and trying to get back and being in big crowds. And I remember not wanting to be in crowds and not wanting to be around people because you're adjusting. And it's the same thing now when I've gone out to dinner. I feel weird because I'm like, the bigger crowds, I'm uncomfortable. And and it's the only thing I can contribute when I came back from Iraq. The same feeling I had is now I have now. I'm a person that needs to be out in crowds, right? You have to be out there with the pom-poms in your hand and getting everyone going. And I'm like, even at the dinner, I'm like, all right, I want to keep my distance. I want to keep my distance from people, even though I'm fully vaccinated. I know people around me are. I've been in that same nucleus for 61 weeks, and a lot of people have. And you get used to that little core of people you're with. So the seniors aren't the only ones just going through it. Everyone is. And like I said, it's going to take time to get adjusted. But I'm excited to announce that we have to start getting back to being open, and we have to start getting back to some type of normalcy. And today we're reopening the Waterville site, our mail site, at 1501 Broadway, and it's we're giving it the green light, and we're only going to run it at about 75% capacity. We're going to see how the seniors feel coming back together, as long as they're vaccinated and we do everything the right way. So it's going to be challenging, but I want to say that these mail sites are critical to the mental and emotional well-being of our older residents, and before COVID, these sites serviced over 2,376 seniors at 17 different sites throughout Albany County. The Waterville site, like I said, will run about 75% capacity, and it's going to be a pilot program. We will be scheduling other sites to reopen up May 17th and more on June 1st, and then another one on September 1st to get back. But I do want to thank Waterville Mayor Pat Ciselli and LifePath Executive Director Holly Cargo-Corman for and the media availability we're going to have today at noon at that site. We're going to be there at noon doing a little ribbon cutting and celebrating, getting seniors back out, back together, and again to socializing and getting over that nervousness a little bit. But Deb, please, and thank you for the job you've been doing, not just for the seniors and reinventing the way we do senior services, but working with Rite Aid and everything else. So Deb, thank you.
Thank you. We're very excited to be able to open up again the senior center at Waterville for congregate meals. What a difference a year makes. We were closing everything down, and we tried to open it up again back in the summer, and things went south very quickly, and then the meal sites needed to close again. And they've been closed, and as our county exec, who has worked very hard at keeping us safe, along with Dr. Whalen, the seniors have suffered a lot with isolation, and they're going to go through reentry crisis, because we all are, with getting back to work, with being able to go out to dinner. Although I didn't have such trouble with that. We're very excited today. As county exec has said, we have 17 sites that need to open sometime in the next few months. We have a lot of programs that needed closure because of the proximity of caregivers with in social adult daycare with the seniors. Things needed to move to virtual. We all look forward to being able to get back together, and today is an example of that. So we're keeping good thoughts and hoping that it's all going to go well, and the seniors will show up today. So
thank you, Deb.
That's it.
That's it?
That's
sure?
not quite it. Not quite it. As our county exec alluded to earlier, I was very privileged to be able to have a collaboration with for vaccinations for seniors with Rite Aid and Congregation Temple Beth Emeth, who, if they hadn't opened their doors to us, I'm not sure this would have happened. But we were able to do that, and so people would come in for a vaccination, but when they would come for the second vaccination, I decided it needed to be a celebratory event. So we had congratulation signs everywhere and balloons, and we gave out big thank you notes. And if you're looking back, you will see a thank you to our county exec, who all of it was dependent on him and his vision. And I will show you the back of it, and I don't think you can hear me. Here's a big thank you card for you. But if you look on the back of it, the seniors wrote notes to our county executive thanking him and signing their names so that he would know that they were there and that they thanked him and that this was a very important moment. And so we're very happy to give this great big thank you card to our county exec. And I hope you will take the time to read the notes that people wrote you.
That's very nice. Thank you, Deb. And again, it's been hard for all of our departments because we do deliver critical services in a variety of areas. And if you don't know about them, thank goodness. That means that you don't need them. But there's people out there that need them, and there's people that never needed our services that need them now. So please do your job. Don't hesitate. Vaccinate. Educate yourself. And we will continue to open up and get to where we need to be. Before I end, I do want to say I can't answer the questions about Texas, and I don't throw anyone in the spot about Florida. That's been wide open, no masks. I'll talk to everyone that goes there. Look, all I can tell you is that for 61 weeks, Dr. Whalen and I have followed the science and educated ourselves and done what we think is right for the people of Albany County. And I've said it before, it wasn't about getting votes, it was about saving lives and stopping the spread. And, whether you agreed with what we had to say, you agreed or you disagreed, that's why this nation's so great. We can have that fundamental debate, agree to disagree, and still continue to communicate and move forward. And again, one of the hardest parts of our job is making sure that we make decisions based on science and the facts to save people's lives, not on the popularity of what people want. And that's the hardest thing in politics. If you truly want to be a leader in any of your community fields, you sometimes have to go against that ocean wave that's coming to crash on the beach when everyone's coming at you. You gotta say, no, it's not the right thing. I'm proud of the job of working with Dr. Whalen and her team and everyone in the county and my force, so thank you. Albany County residents, please call the New York State hotline number or anyone in the Capital District, 1-833-697-4829. And, we still have the Washington Army going, Crossgates Mall sites. You can also get the Johnson & Johnson, the single shot at those locations without an appointment. You could walk in. I think we're hoping to get some J&J this week, and Dr. Will, if we do, she'll get it out in a timely manner. The United Way is always the 211 number. Thank you. The Albany County website you can go to. And our mental health support line, I do have to get Dr. G in here to talk about that, but that's slowing up, which is all good news. That means we're getting there. From 8 a.m. to 5 p.m., 518-269-6634. It is about mental health. That's where I was in Town of Colony this weekend at the crossings. And to the Shaker students, phenomenal job. And I promised her I wouldn't forget her name, and I did. I'm sorry for the girl from Shaker that got into Notre Dame. She's going to Notre Dame this year, and she did a great job and phenomenal job. I took a picture with her, and to her parents, they raised one hell of a kid. And to all the kids that were involved to make a difference, realizing that kids are struggling with some issues. And unfortunately, we said this before, and it's not easy for me to say, teen suicide is up, adult suicides are up. It's sad, and as being a person that has lost multiple friends to suicide, it's not easy to identify and say that you're going to get it right and help that person. So that's why I say to people, take that opportunity, talk to somebody on the phone, reach out to somebody you haven't talked to, and God, if you're fighting over something you can't even remember what you're fighting about, let it go. Let it go, and move on. Because how many times have you stopped talking to a friend or a coworker, and you're like, I don't even know why I stopped talking to him. You can't even remember. So that means it really didn't matter. So at this point in time, please, I used to say hugs are better, but you can't do that anymore because of COVID and now with everything else. So I'd say to you, please reach out to somebody, talk to them, and be there for that friend. And trust me, they'll be very appreciative. Our 24-hour sexual assault hotline number is always 518-447-7716. Please stay out there. Please continue to be vigilant. Please continue to wear a mask, cough into your arm, clean your hands 6 feet apart, and be safe.